day of which I'm grateful. How about you? This morning, I looked on one of the plaques in my house and I was just impressed, really impressed, to share it with you today. It says, like, if we all did what we're capable of doing, we would literally astound ourselves. And that's coming from Thomas Edison. I'm here to say this afternoon that you have the potential and you just have to zero in. You just have to be consistent. You just have to be determined to accomplish your goals. It's doable. And I'll share my story with you right now because there's someone out there. We have more than approximately 9 billion people out there, and your story is important. Your story can impact someone just about any part of the world. Did you know that? Someone wants to hear your story. And so I will share a little of my story with you. So, when I was a little girl, I wanted to become a nurse or a social worker. In my time, there weren't so many, I would say, different careers or occupations that you could have chosen. So I was a, I would say I was exposed to nurses, like nurses coming to public health nurses coming to our schools. I was exposed with the midwives carrying the little black bag when they're going to attend to pregnant women. I'm used to, like, if I see the nurse in the hospital setting or something like that. I know that social worker would uh, navigate areas, check out to see that things are work out for individuals, families in need. So that was my exposure then. And there was one day when my brother and other community members in the community, children in the community, were playing cricket. And one of them, his ball hit me right here. And they had to take me to the doctor. It was so painful. But after all of that, I realized more and more that that caring, wanting to care for somebody and helping was in me. And that started blossoming more and more. And when I finished high school, I had to decide what I really wanted to be, according to our custom. So I said I wanted to become a nurse. My mom, who I've dedicated my book to, she's passed. She has passed 3 years now, 2022. It's going to be 4 years this year. Yeah, 2022. Uh, I recall saying to her that I want to become a nurse. And I remember when she took me to the school to matriculate, and fast forward, I became a nurse. After becoming a nurse, I worked at different hospitals in the West Indies. When then I was recruited here. So my school at the time was, nursing school was West Indies College, now Northern Caribbean. I also went to University of the West Indies and I did 1 year uh, postgrad course in critical care. So upon that and nursing experience in Jamaica, West Indies, I was recruited here as a critical care nurse. That's how I came to this Big Apple. And ever since I've advanced, yes, of which I'm very grateful to all who helped me along the way. Now, I will hasten to say, never forget where you're coming from. Never forget where you're coming from. Anybody, never forget where you're coming from. And so there are others who helped me along the way. And to be emerged into this big apple was an adjustment for me. And I managed. I met others who were fighters like myself, who were resilient, and I worked in different areas of nursing. The last area I worked in was in as a educator, nurse educator. But before that, ICUs all over town. I worked in different areas of academia. I taught at different universities. Yes, I did. And one of the most rewarding things that I've experienced is to see some of my students that I taught who are doing exceptionally well. And I can recall one of them who was awarded at one of the universities, and she sent me a picture, very stylish picture, and said, "See your girl." That made me feel so well, so accomplished, so satisfied. And so I am one of those who have seen my new nurse coming from the past the NCLEX, they're coming into the institution to work. And I had the privilege of what? I had the privilege of onboarding them. And I can recall some of them would be saying, "I've never done this procedure, I've never done that." And I would take them and I would share with them, I would show them, I would demonstrate, and all of that. And see them from onboarding to orientation and to see them now proficient, proficient from novice up the ladder to expert to being proficient, doing their thing, making decisions. And that is very rewarding. So today, I just want to let you know that my choice for deciding on empowering new nurses was influenced by all of those components. Yes. So, empowering new nurses is one of those programs that you get to be a part of. Our mission is to equip and inspire and support nurses as they transition from one area to the other. Professionals as they gain their position. How we do this by providing education, mentorship, and of course being resourceful. You help them to be competent and to advocate for themselves and also for the patients as they deliver compassionate care to patients. Now, let me hasten to say that for me, culturally congruent care is very high on my priority list because in an area where we have diverse populations, yeah, we have people from all over the world, different languages, different sexual orientation, bringing them to that point where they receive individualized care is optimal. It's critical, so significant. When one receives the care that he or she can identify with, it makes a world of difference. And the patient will be satisfied as well as the nurse or the caregiver. So, my take on this all the time is to provide culturally congruent care. And some of my patients might tell you, some of my students and my patients might tell you as I care and as I interact. So important. Well, Someone, a patient might not, with a certain diagnosis, or a patient from a different culture might react or respond in a different way. How will you be able to give that type of care? Well, talk with the patient. Talk with the patient. Okay. Research. We have the internet. It's like this at our fingertip. We can talk with our patients. We can research. There's so many resources that are available now in comparison to other time. So my encouragement to you this afternoon is to be strong. Remember, you were meant to be. You're meant to be a nurse. You're meant to be a nurse. Don't allow any one thing to make you want to leave. As I said some time ago, I went to a podcast conference in Dallas, Texas. And I recall talking to different individuals. And I remember one in particular who said to me, my sister left nursing because it was not nice, or they weren't nice to her. My take on that, yes, there can be difficult times and situations, but never, 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 never let anyone cause you to make that decision. They're winning in that case. So you have to be the one to be resilient and go for it. You know, you were called to this profession, it wasn't just a job. So if you need support and you seek support, and I would encourage you to have a mentor. And that mentor doesn't have to be one from your institution, can be somewhere else. I've got calls, I've got information of individuals asking questions. You know, they want to upgrade themselves. And of course, wherever you are, the sky is the limit, and you can pursue whatever you desire. Remember, when I started, I said, if we all did what we are capable of doing, we would literally astound ourselves. So I'm encouraging you that if you have a passion for something, remember you're individual and you have a purpose to be here. This writer says they are going to be the lesser and the greater than yourself. And therefore, don't let anyone deter you from your goal. But remember, there's some key words. You have to be disciplined. You have to be intentional. You have to be consistent. And all those positive words. Speak positivity over yourself. Lean in on the positive. Find like minded people, people who are going somewhere, people who are passing it forward, making and paying it forward to help you, because this world would be a better one if we all cared and shared enough. Thank you so much for listening. I want you to subscribe to my channel. My channel is under Miriam Amanda Smith. I want you to subscribe, and I want you to share the link. And just to let you know that very soon, the book Grace, Empowered by Grace, will be coming out. It's a small booklet. However, because I was impressed to do that, and because I know that many nurses feel overwhelmed at times, I've shared some of my pointers, what helped me to cope in my time. And I know now, in many ways, it's more challenging. So it was nice talking with you, to you, and talking for you. Those who are listening there, and those who are listening there, and those who are living in different parts of the world, remember that it matters. Your contribution matters, and you are called, and it's not just the job, but you're called for a purpose. And so If it's caring for the most vulnerable, let it be the best that you can do. Do it and do it well, exceptionally well. Be blessed. Miriam Smith, the host for Empowering New Nurses. Thank you.